Corla. Leia profits soar to 36.55 million. That's the headline in the newspapers, I think, earlier this year. Profits up by 14 million. AXA, I don't have the figure for profits, but now 2 billion coming in premiums. They have 30% of the Irish market. Leia have 28. I think now AXA are underwriting, are they? It was reported underwriting Leia premiums now. So this is big business and big profits. And those profits are generated through the fear that about 50% of working people in this country have of what happens to them if they get sick and they have to rely on the public health service. Because they know that if they have to rely on the public health service, the chances are they will be on a waiting list. The chances are that they may have to wait considerable amounts of time, maybe dangerous amounts of time, for procedures to alleviate their illness or to alleviate their pain and all the fear and anxiety that goes with waiting for diagnosis and waiting for treatment. So out of fear, not because people want to pay out €1,600 or a couple of €1,000 a year in insurance, but out of fear of the inadequate resourcing, staffing, capacity, funding of the public health service, they are driven out of fear to private health insurance, and then the private health insurance companies clean up. So that's what all this is about. And the risk equalisation that we do every year with this bill is a measure to somewhat ameliorate the profit grabbing so that there's not wild disparities in the premiums that might be charged by these profit-driven companies, or mostly profit-driven companies, based on the age you happen to be or your state of health. Although, let's just remember, the reason we have to do that is because if we didn't do it, they'd rip you off even more. They take even more money off you. And of course, we know that the consequence of this in countries like the United States, where you have, the full-blown two-tier health system. Ours is a two-tier health system, slightly mitigated, but where they have the full-blown one over there, they spend more on health than any other country in the world, but vast, vast numbers of people have no health care at all. Because if you don't have the money, you don't get the health care. It's as simple as that. So we're on that trajectory. And in the United States, you're in a sorry, sorry state if you don't have the money to pay these profit-driven companies to provide you with the health care when you get sick, when you're vulnerable, when you're old, or when you have disabilities. So, to my mind, the whole operation is pretty disgusting, and we need to move rapidly away from it. But of course, it's self-perpetuating, and of course, the government say, no, we're committed to a single-tier system. We want to get rid of this. Launch a care. How long has that been? Did we all commit to that? Not. Is there any serious move towards that? Not a bit of it. Not a bit of it. The private healthcare providers, it's fully entrenched. Fully entrenched. Briefly, during COVID, when we had to, and because some of us were screaming at you to do it, and because of the scale of the emergency, for a brief moment you took over the private healthcare capacity because we had to have single-tier response to COVID. And instead of moving on from that to maintain and take that private capacity as part of a single-tier health system and use the capacity that the private system has to actually alleviate the crisis that exists in our public health system, we gave it back to them so they can make more profits, more money, that Larry Goodman, who owns the Blackrock Clinic, and all the rest of them can make more money out of it. Good old Larry moves from meat, animal meat, to human meat and makes a lot of money out of it, as do many, many others. And I find it really, really quite revolting. And I don't think there's any serious intent by the government to address this and to provide healthcare to everybody, regardless, on the basis of their health needs. That's what a decent and humane system, and would adequately resource this. And I do believe that the government's failure, of course they will shake their heads and say, no, 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 this is not true. The government's failure to properly staff the public health system and to properly resource it is part of, either consciously or unconsciously, is part of creating the conditions which allow the private healthcare companies to make profit. The Minister, of course, will deny this and say, no, we're trying to recruit people. We had this debate today, I brought it up with leaders, and the government was shaking their head. No, no, the government aren't gaslighting the public. They really are trying to recruit people. There is no embargo. But I asked in St Michael's, again, I just got it today, after the debate. I wish I had this this morning. I got another answer about St Michael's, my local hospital, to ask the Minister for Health to confirm the number of staff who are on maternity leave at St Michael's Hospital at the moment, and if cover will be provided. And the answer, there's six staff on maternity leave, 2 senior physiotherapists, 3 enhanced nurse grades, and 1 management admin grade 6. Maternity leave cannot be provided within our current financial and employment control limits. Absolutely clear. Paying numbers, you're not getting the staff, you're not getting the maternity leave covered, and if that means we don't have the nurses on the wards, we don't have the physiotherapists for the people that need them, tough luck on the patients, and tough luck on the rest of the staff that are left to pick up the pieces as a consequence. And that is repeated in hospital after hospital after hospital on a far bigger scale than St Michael's Hospital, a relatively small hospital in my area. Now, is it any wonder that in that situation people would say, well, we're going to have to go to the Blackrock Clinic. We're going to have to go to the Blackrock Clinic. And the thing is, an interesting point that was made to me by some of the St Michael's healthcare workers, and actually also a guy who worked in recruiting for the agencies, so he's part of the private thing, but he said, you know, when the government say they're trying to recruit people into the public health service, he said, how is it, if they're trying so hard, but they just can't, it's difficult, they really are trying, but it's just difficult to recruit people, how is it they're able to recruit people from the agencies? We can't get them for the permanent jobs in the hospital, which are decent jobs, secure jobs, but we can get them from the agencies, right? So the truth of it is, you're not trying to recruit them in many cases, and in some cases just policy. We're not covering the maternity, people out on maternity, people who leave are not replaced, because if the staff required to replace the person that leaves takes that hospital area over the quota, well then you're just not getting them. That's it, you're not getting them. As the radiotherapists or the radiation therapists explained to me, if people leave, they might get replaced, but they might not if the ceiling has already been hit. And therefore, in their case, machines lie idle that provide life-saving treatment to people with cancer, and what are you going to do? Well, very likely you're going to go private if you are facing the prospect of a condition that might end your life. What choice have you got? If you have the resources, and if you don't have the resources, well, you're in a dark space. So just finally, or another little example, this is just from St Michael's, small hospital in my area, to ask the Minister if a CT scanner has been considered for installation at St Michael's Hospital. I just got this back as well. A business case for a CT scanner was submitted to the HSE in 2023. An outcome is awaited. 2023 CT scanner. Yeah? And we couldn't come up with a response to that in a year. In a year. So, yeah. That's why people are driven into the private health insurance market. People make money out of it, but it perpetuates an unfair two-tier system and perpetuates the problems in the public health system.
Deputy Boyd Barrett, your contributions are always colourful. But you made a comment earlier about Mr. Goodman, and you talked about moving from animal meat to human meat. I don't think that type of comment is appropriate. It's dehumanising both of the people who receive treatment in the hospital and of the gentleman you referred to. So maybe you'd withdraw that comment.
I'll as a deference to your good self, Ken Corla, I will do that.
I appreciate that. Now,
thank you very much, Ken Corla, and can I thank deputies for their support of the bill. It is greatly appreciated, and I look forward to going to committee stage. Now, what I'm going to do with the time I have is address some of the other issues that colleagues raised. And whether I should or not, I'm going to start with the contribution from Deputy Boyd Barrett, because I listened to probably 5 minutes of misinformation during Leader's Question, which Deputy Boyd Barrett brought in. And I do now have a chance to respond, and I'm going to use that, because Deputy Boyd Barrett, Ken Corla, stated very clearly that no progress is being made. He sets himself up as the champion of our healthcare workers, and he says there is no progress being made towards universal healthcare or sláinte care. So our healthcare workers have halved the time people wait for an outpatient appointment. Deputy Boyd Barrett says that's irrelevant. They have revolutionised women's healthcare. Deputy Boyd Barrett says that's irrelevant. They've brought in IVF, free contraception. They'll be about to bring in free HRT. They brought in specialist services in menopause and endometriosis. Deputy Boyd Barrett says that's not progress. That's not relevant to anybody. They have invested in cancer services. Cancer survivorship rates are getting better and better and better in our public hospitals. Deputy Boyd Barrett said that's not relevant. It's not important. That's not progress. We have massive new community-based services in and around his constituency, mine, and everywhere else. Deputy Boyd Barrett says that's not relevant. We're not making any progress. The healthcare workers aren't making any progress. We have had a massive reduction in costs for patients, but apparently that's not progress and it's not relevant. Apparently free IVF, free contraception, 500,000 more GP cards, apparently these things are not relevant. They are relevant. And I want to acknowledge Deputy Cullinan, Deputy Shortall, Deputy Berry and others who, at least whilst rightly holding this government to account, to their credit, do acknowledge that our healthcare workers are making things better for patients. Is it better across the board? It is not. It is not. But let me tell you, the waiting times in this country, our healthcare workers have brought the waiting times down from over 13 months to 7 months, and we are going towards the agreed sláinte care targets that no one waits more than 10 to 12 weeks. But apparently that's irrelevant. All of the progress that our healthcare workers are making, apparently according to Deputy Boyd Barrett, it doesn't matter. Well, it does matter, and we are making progress. And I want to fully acknowledge the point that was put to me by several colleagues saying, yes, progress is made, and they asked me, but will I accept that we are only some of the way there? 100% I will accept that. I think we're about half the way there. I think we're about 4 years into what is an 8-year turnaround to get to where we all want to get to, which is universal healthcare. It is the single-tier public system envisaged under sláinte care, where care is affordable, care is timely, care is high quality, and the new services exist. And contrary to some of the misinformation that we hear in this chamber and elsewhere, contrary to that, I want to acknowledge that the healthcare workers in this country, the doctors, the nurses, the health and social care professionals, the Department of Health officials, the people working around this country, our GPs, our pharmacists, they are working night and day to make things better, and they are succeeding. Now that doesn't suit everybody. There are some people in this chamber who want the public to believe that we live in a failed state, that everything in healthcare is terrible. Everything in healthcare is not terrible. Things are getting better every single year. They're getting better every single month. Are there parts of our healthcare service which absolutely do not work for patients? Yes, there are. Of course they are. But you know, just this week, after years of work, we were able to announce really important progress on children's spinal. We were able to announce that this year the number of children waiting more than 4 months will fall from 86 to 20. It's still 20 too many, I fully accept that, but 86 to 20 in 1 year, and all 20 of them in consultation with their surgeons will be offered care in the United States. And I appreciate the facts don't suit some members of this House. I appreciate the facts don't suit the failed state narrative that our doctors, our nurses are achieving nothing on behalf of patients, but they are. I work with them every day, every week, every month. I've worked with them for 4.5 years. They delivered one of the best results on COVID anywhere in the world in terms of excess mortality, right? And the improvements that I'm talking about have been achieved by our healthcare professionals, and I want to acknowledge that. We spend a lot of time talking about hospital-based care, quite rightly. But look what has happened as well in community-based care, again, as called for under Sláinte care. In my own constituency, we don't have a big hospital. We don't have a Model 3 or a Model 4 hospital. But just in my time, I've opened 4 primary care centres in Wicklow, in Bray, Arklow, Rathdrum, Baltinglass. Planning permission has gone in Greystones, and there's going to be an expansion in Wicklow town. That's just in Wicklow. We've given a huge amount of money in terms of daycare centres, Meals on Wheels. We're expanding the community nursing centres. We've allocated €5.5 million to the cancer support groups all over the country. Again, just in my constituency. It's Purple House in Bray, Greystones, Wicklow Town, Arklow, Rathdrum, Roundwood, West Wicklow. And that's just some of the community-based improvements in healthcare in a county that doesn't have a major hospital. And so, again, Corla, I'll finish on that, and I apologise if I'm a little agitated. But I come in here again and again and again, and I hear certain deputies in this House saying nothing is improving. The deputies over here talked about cataracts. Here's what's happening on cataracts. Until this government came in, the waiting time for cataracts for adults, where we stand now in Dublin, was 5 to 6 years. It's now less than 12 months and falling to the agreed Sláinte care targets. Children who were referred in for specialist care. Now, I appreciate you don't like the truth. I appreciate that. I appreciate the truth doesn't suit you, right? Fully appreciate the truth doesn't suit you.
A little bit of manners, please. Let the Minister reply.
Democracy may not suit you, the truth may not suit you, but our healthcare workers have reduced the waiting time for children in the Dublin area and other parts from 2 to 3 years to 6 weeks. Now, what about in your own area? You're aware of the really important investment we're putting into Ballincollig. You're aware we've taken the cataract surgery out of CUH, we've put it into the Royal Infirmary and Ballincollig. And if you look at the figures, what you will find, I fully accept it's not fixed. I fully accept we're not there yet. But what you will find, Deputy...
We're not I asked you that question.
The democratic debate may not suit you. I fully appreciate that.
Why did you close down to the answer
Appreciate the parliamentary debate.
Why did you close it down?
And I appreciate that the record investment into healthcare in Kerry and healthcare in Cork doesn't suit your election campaigns. But it is nonetheless true. And no matter how much you shout at government, no matter how much you come in here with false information, it is a fact. It is a fact.
Please, Deputy.
It is.
No, please. You're making this into another Hall's Pictorial Weekly. Would you please? Sure, he's not here to answer that particular question. Will you resume your seat, please? Will you let? It was, but this isn't. This is not a comedy show. It is not a comedy show. Would you resume your seat? Resume your seat, Deputy. Please. Please. Now, can we... Deputy Collins, would you please let the Minister respond?
It may not suit you that there is record investment going in. And by the way, not for a moment am I suggesting that everything is fixed. Deputy Cullinan, Deputy Shortall and others have quite rightly pointed out that we have several years to go. But it is undeniable that our healthcare workers, who have been hired in record numbers, are turning this ship around. In my constituency, in your constituency, they are doing that. They are turning it around. They are reducing waiting times. They are rolling out new services. And Deputy, you can shout as much as you want, but it will not take from the improvements that healthcare workers are making in your constituency and in mine. Gurmagat Count Corla.